With the start of classes coming up quickly, many parents in the mountains are watching anxiously as school districts decide what school will look like this fall.
The governor's office recently recommended that all students and staff should mask up indoors, but many local districts are choosing to make face coverings optional, while others have reversed that policy and will now require them.
Over the next 2 nights, we will visit several local communities to find out more about the COVID policies and how parents are feeling about their children's safety.
News 13's Karen Zakalak looks at plans for local elementary schools where students under the age of 12 still can't get the vaccine.
I think that my kids and kids under 12 really are more vulnerable than ever.
With 3 young kids, Shanna Peel says COVID remains a constant concern and conversation in her house.
It's on my mind when I wake up. It's on my mind when I go to bed.
Last year, she was able to stay home as her children learned remotely, but this fall she'll have to return to work and worries about how safe her kids will be at school.
I just don't feel like removing safety precautions is something that we can negotiate with at this time as a family.
On July 30th, new school guidance went into effect from North Carolina's governor, giving local districts a choice when it comes to masks. But it also recommends that all schools should require all children and staff in schools K through 12th grade to wear face coverings consistently when indoors.
All in favor?
Aye. Asheville City is one of the few districts locally that's decided to require masks for all teachers and students regardless of vaccination status. That includes buses also. April Dockery says administrators made the decision as a team after reviewing data and research from the CDC and local health department.
Majority of our parents understand the need for this face covering. No one loves it. We want to see our children and their beautiful smiles, and we want our teachers to feel safe. But right now they're willing to work with us and support us in this process to be able to keep our staff and children safe and healthy.
Because when we're outside, we can take it off.
About 30 minutes west, we found parents and students themselves split about whether masks should be required.
I would want to wear a mask for part of the year and see how things are about Christmas time.
If they allow it, I'll prefer her not to wear one because of her breathing issues, because it does become cumbersome on her breathing.
Well, they need to make it where they have to wear them until this slows down.
In Swain County, it was clear how much these decisions have weighed on longtime Superintendent Mark Sale throughout the pandemic.
There are many, many nights that some of us are lying awake, rethinking everything that we've done and every plan that we've made. There are no words to describe the difficulty in that.
Keep your masks up like they're supposed to, please. Thank you.
The school board originally voted to make masks optional, but then reversed that decision, requiring face coverings for staff and students, a change school leaders believe is the safest option right now.
We've had to be prepared all of the time to shift, and it might be overnight. So the stress level that creates has been quite a bit different than what we are used to.
In Haywood County, Superintendent Bill Nolte said all summer he heard from parents and teachers who were also strongly against a mask requirement.
The vast majority of them said things like, we think this should be our decision as parents. We don't think the governor should make this decision. We don't think the school board should make this decision. We think it should be our choice.
Haywood County, along with the other districts we talked with, are choosing not to offer virtual classes this fall.
We're at this point shying away from all remote learning because we know it was only effective for a very small percentage of people.
For parents on both sides, it's a struggle that won't be over anytime soon.
It's hard finding that balance between keeping our bodies safe and keeping our hearts safe.
Karen Zakalak, News 13.
COVID cases among children are increasing. Now, the American Academy of Pediatrics is asking the FDA to speed up its vaccine approval for kids. The group says last week, 94,000 children tested positive for COVID.
Staff at Asheville Children's Medical Center say they're seeing big numbers too, with COVID cases in kids tripling. News 13's Kimberly King talked to a doctor there today.
This back door is now the dedicated entrance for the COVID sick clinic for any child suspected or positive for COVID. We are seeing appointments coming in here and booked back to back.
This is a nurse. How can I help you? Was he exposed to COVID?
Pediatric nurse Megan Gaffigan's on with a parent whose son has a fever of 102.
We are just inundated with COVID patients. Our PCRs are coming back positive left and right. It's bothering me so much that I wish that I could get my 1-year-old child vaccinated.
Pediatrician Dr. Bridget Fogelman suits up to see all the kids getting sick.
We've seen more children come in with fever, more nasal congestion and cough most recently.
Brothers Kamari Splawn, 13, and Kuwait Davidson, 6, feel fine but are in after a possible exposure last week.
Did a little girl in your camp test positive for COVID?
Yes.
And is that why your mom brought you in today?
Yes.
Theodore Krausman is getting his children tests.
I own a club downtown. A member of our staff had tested positive.
Okay, let me do this side, okay?
For the brothers, the swab was just a little tickle as they wait for results. And with school starting in just 2 weeks, they're keeping their masks on.
Dr. Fogelman, you're obviously aware that there is discussion among school districts. Some are deciding to make masks optional. Would you be worried for the children that are attending those schools?
Absolutely. Universal masking should be mandated for staff, for students, regardless of their vaccination status.
A nursing assistant here tells me just yesterday, of 6 children she tested for COVID, 4 came back positive.
Tonight, a new COVID cluster has been identified at a local restaurant.
The cluster was narrowed down to several employees working at an Italian restaurant. News 13's Hannah McKenzie is live in downtown Asheville. Hannah.
Ty, Holly, well, just as news broke of this COVID-19 cluster in Haywood County, here in Asheville, the Asheville Independent Restaurant Association, or AIR, announced some news of their own. They want customers to know if you dine out, you better mask up. A COVID-19 cluster at this Haywood County restaurant.
We identified a cluster at Frankie's.
A cluster, Haywood County Public Health Director Sarah Henderson says, is defined as a minimum of 5 confirmed cases with plausible linkage between those cases.
They currently have 5 cases that we've identified in-house.
Frankie's Italian Trattoria announcing on Facebook Monday they're back open after closing for a week.
There's no requirement for them to shut down. We just like to make sure that they've cleaned and disinfected everything before they reopen.
A manager telling me over the phone the restaurant has been sanitized and all staff currently working have been tested for COVID-19 and cleared by a doctor.
It's got diced fresh vegetables on it, gorgonzola cheese, and balsamic.
News of the COVID cluster not scaring off customers like regular Pam Paget.
I know that the owners are very family-oriented people. They wouldn't have opened if they didn't feel it was safe for the community.
This as the Asheville Independent Restaurant Association, or AIR, Executive Director Jane Anderson announces they're urging anyone who's dining out to mask up.
We just don't want COVID to disrupt our business anymore. People need their jobs and the owners need their businesses.
Michel Baudouin is one of more than 130 locally owned, independent Asheville-based restaurant owners involved with AIR. His take, no mask, no service.
Can't afford another shutdown. You know, once is enough. It was painful enough.
And a word of caution from Sarah Henderson, the Haywood County she's the Haywood County Public Health Director, if you are planning on eating out, make sure you wear a mask when you are not eating and distance yourself from other customers. And when appropriate, eat outdoors if you can.